afternoon.
Good morning.
Good morning. Right start on Freeze 87.9 FM. It's now 8:01 and 30 seconds. We have some wonderful guests here in studios. Good morning.
Good morning,
Good
Dwayne.
morning.
Good morning.
So, I wanted to introduce yourselves. So
I'll be happy to do so. First, I'm Nadine Tomlinson Brown, for those that may not know me. And I'm working at the Savannah Medical Clinic right now as the community relations and clinic administrator. And pretty much that in a nutshell is that I am there to serve the community regarding their healthcare needs and make sure that that is met, and also to assist my team to ensure that all their needs are also met, that we can have a seamless clinic running.
Okay. And the wonderful lady in the middle, who looks so familiar.
Well, good morning. I'm Dr. Tanika Grant. I'm a consultant obstetrician and gynecologist, and I'm one of the newest additions to Savannah Medical Clinic. I have come to bring holistic care to women from all ages of reproductive age, so from teenagers, adolescents, all the way up to menopause. So I come with this new addition, and I serve the community in my spare time. And as our director here said, we come to serve the people and to help in all the ways that we can.
Okay.
Awesome. And of course, I'm Robert Lynch, and I provide marketing and technological support to the team to just create a seamless connection between doctors and patients. And when we talk about the things that we're going to share today, persons are just going to find how incredibly easy it is to participate, support, and connect with the Savannah Medical Clinic.
All right. I've been to the Savannah Medical Clinic probably 3 times. No, it's more than 3 times.
I'm thinking it's the old location, Dwayne. Am I right?
You've been to the
You've
new
been
one?
to the new location
Because
yet?
that's what we're talking about today.
Superb.
No. You're at Country Corner now.
Country Corner.
Right.
I went to the one in Countryside.
There you go.
Exactly.
So is there no longer one in Countryside?
No, there's no longer one at Countryside. We have now moved our location to Country Corner.
And it's
Oh.
now bigger and better than ever before.
Okay. All right.
And more service.
I promise you, if I get sick again.
You don't have to wait till you get sick, Dwayne,
Alright,
because
alright.
August 1st
Yes.
is why we're here.
Yes.
All right.
It's our customer appreciation day, and we'll talk more about that, but you can meet us there that day.
All right.
There'll be
all right.
fun and games. It's like a fun day.
So I like what you just said. So you don't have to wait until you're sick. We actually invest a lot in preventative health care.
Exactly.
So we have a range of different things that actually aligns with that, from your B12 shots to our weight loss program and to even our gynecological service, which I'm going to tell you about.
Elaborate more on.
We have a revolutionary technology that we offer to women. So a lot of women don't talk about this, but a lot of women leak. So they cough or sneeze and they pass some urine. They don't tell anybody about it. They hide it. They wear, their pads,
Yes.
and nobody knows
Very.
about it. So I picked that up in discussion with my patients, and we actually got a chair into our clinic, a special chair that helps with that. Right? It's not surgical, and we've had such, what I would say now, such
Great testimonials.
great
Some
testimonies
great
and
testimonials
success.
of
With the
success from
chair
it.
that we want to bring this to the community.
Mhm.
And it's something that patients can come in, they can sit down, they don't have to take off their clothes. It's a
Comfortable.
nice special room, courtesy of Mr. Dean provide a nice special room. So you can take 30 minutes to just relax and get treated. So I like to tell the patients it's like Jetson's technology. So you're sitting down, it's doing the exercise for you, you're not feeling anything, but the results are
Remarkable.
excellent, remarkable.
Wow.
Right.
You have anything for men?
Oh, yes.
Well,
yes.
listen. So we are very inclusive.
Yes.
So even though it has come for for female treatment, it actually helps with erectile dysfunction for men, because it helps to increase the blood flow down there. So as remember we said, it's not just to treat, it's preventative. So even
Definitely.
people who don't have any problem with the urine, it helps to strengthen the pelvic muscles. So if you've had a
Children.
baby, right? So if you've had kids, postpartum, there's a postpartum part of the chair, so it
Mhm.
helps to recover the pelvis. So even if you're not ill and you just want to strengthen your pelvic muscles, preventative, you can come and take part in the program.
Incredible, and that's good to note because sometimes we use the word erectile dysfunction and it causes a little bit of hesitation. But what you're saying is it's not just for dysfunction.
No.
No.
It helps to strengthen and increase
That-
your.
That doesn't happen.
There you go.
And increase the blood flow to that area.
So persons who would have closer to those prostate age
Hmm.
prostatitis, that's what they call it.
Once you cross the 40, because we were talking about this on last Friday,
Yes.
where once you get past 40 and we're thinking about the digital exam,
Yeah.
this is one of those things that may help with those processes. You want to speak to that, doctor?
Is that correct?
Is that
just-
correct?
No, this is not for the prostate.
No,
No.
I'm saying
Preventative
Yes.
is one that we look at.
with
for-
with the whole prostate situation,
Mhm.
right? And I'm sure that even if it's just an enlarged prostate or whatever it is, what I've heard is that men can just get incontinent
Mhm.
and just
Okay, so usually I think what you're referring to is when persons have like a larger prostate,
yeah.
right? Though this year is not really for that
Okay.
purpose. But interestingly, because I usually do presentations of prostate cancer in the
Yeah.
community, what they found is that persons who had removed the prostate had urinary incontinence.
Yeah.
So this chair helps with that.
Okay.
So that's how it could help for persons who have prostate
Okay.
issues.
Okay.
Alright?
All right.
And we just, before you move on, want to tell our listening audience that it's important when we are talking about preventative. Robert was alluding to it before that many men shy away from this test, but we do not have to do the digital tests, finger tests, as you know it. We will. We have many other tests that can be doing. The blood test, doctor. You can talk more about
Oh,
that.
okay, so-
they don't have to be afraid.
Okay, well, I'd love to speak about that. I usually do the presentation every year. Now, most people are unaware that persons, men in our population, the Caribbean population, also persons in Filipino population, they are increased risk of prostate cancer. Actually, should be screening at a much earlier age. And why is it that men don't do the screening? They're afraid of digital rectal exam. All the men. So all we say to them,
It's called digital.
because these are our digits.
Your digits.
These are our digits. Right. So what we ask is to do at least a blood test.
Yes.
All right. And I find that most persons are actually more comfortable because we've done the
Right.
survey if they have a female doctor.
Mhm.
So we do have, well, I'm the only female doctor. But, we work with the patients. But at least to do the blood test. The blood test is
It's
a
a
simple
start.
blood screen, is a start. And there are some organizations that offer free PSA screens, prostate specific antigen screens. All right, so that is just to highlight that we are holistic. Even though, you see, I'm a gynecologist and I know about men as well. I know about children. So that's the kind of mindset we have at Savannah
course.
Medical Clinic. We're all rounded.
Including making sure that every person who comes in has the privacy to have that private consultation
To have
with the
private
doctor,
consultation.
private meetings with the nurse, or privately sit with the MCELA chair to be able to
Exactly.
have their treatment.
Yes. So, but we also...
Amsela chair.
Oh, that's the special name of our chair. So when you come, you'll see it. And the other thing is we want to also highlight is our weight loss program, right? And that is where we also integrate our holistic care, right? Because weight loss is not just exercise and your diet, it's also the mental aspect,
Definitely.
right? So we have a coach.
Mhm.
We have a coach who helps with the patients. We also have someone who deals with the hormonal part, which would be myself. Because hormones definitely cause weight gain.
Right.
And then we have our general practitioner who deals with the medical part of the weight loss, which we have at our clinic. So with that holistic care, patients can be confident in the fact that they can come in and lose the weight and hopefully in a healthy way, right? So in future, we hope to have some before and after pictures to show you.
Definitely.
Yes, so you can see the impact of the weight
I
loss
guess they
program.
can start with me.
There you go, because you're sharing your personal story.
Yeah, my personal, that I am one of the candidates that went on that weight loss program, and I'm so much happier today because of it. and feels better.
Yeah.
Dwayne didn't really recognize me when I came in,
Yes.
Yeah,
but it is me, Dwayne. It is I.
Let me just keep that conversation.
Alright.
So great. No, I know I said earlier that you were around for 20 years and I was corrected.
Yeah.
That is 18 years.
Yeah,
You've
pretty
been around.
much. I'll tell you a little bit about how Savannah Medical got started, and that was it stemmed from for those who know Dr. S.A. Tomlinson. Dr. Tomlinson is a surgeon and also a general practitioner that felt the need of giving his people health care, exceptional health care at an affordable cost. And that need and vision came about, and so Chrissy Tomlinson came about in 2000. And as you know, that would be 25 years ago. While doing that, he had a lot of his patients in the Savannah region, especially the elderly, and they found it very difficult to drive up to that side when their young ones were at work and stuff. And he's always there in the community, as I said, to know what the need of the community is and how best he can help his people. And so then he thought about that, extending the service in the Savannah region. And so we had a satellite clinic stemming from Chrissy Tomlinson that started in 2000. In 2007, then he started that clinic in that area, and it just grew tremendously. And 18 years later, it is still growing
It
as we
just
speak.
seems like yesterday.
Yes, yes, yes.
Because I can't even fathom. It can't even come to my head that even countryside has been there for 20 years.
Imagine. Time flies.
Time flies.
And it waits for no man. And so we're jumping on and we're flying with it.
I've always thought that persons who studied medicine has the heart of God, heart of Jesus, because he was always healing people as well as he go around. So I think, I changed my mind. Once I thought they were just like mechanics, technicians, who just fix up something.
Yes.
And
Need some oil change, go to the doctor.
it's more than that. They
Much more
actually
than
have a
that.
heart for
Of course.
seeing people alive.
And that heart extends beyond the
Compassion.
medical. Doctor, as Nadine mentioned, the commitment to affordable healthcare, the commitment to efficiency, the commitment to access to healthcare has just been something that's been there from day one. I can remember even as a patient going to Chrissy Tomlinson, and part of that process was built in. Hey, they'll offer discounts, they'll offer payment plans, they'll offer different things to make sure that when you come in for healthcare, the price or the money shouldn't be the thing that makes you stay home and be sick.
Not at all.
And that commitment is still there at Savannah Medical Clinic today.
Well, I myself has great experiences, not just with Savannah Medical Clinic, but with Chris Tomlinson. My two kids
Delivered.
were delivered
There.
by Dr. T right there.
There you go.
He didn't allow anybody else to do it.
My two kids. Hello, three was delivered. Yes.
He didn't even allow anybody else to do it. He did it himself. And I think this you're going to be having a customer appreciation day
Yes.
on
Definitely,
Friday.
definitely. I want to talk a little bit about our staffing
Yes,
also. At the Savannah Medical Clinic, we have 3 physicians. As I mentioned before, Dr. S.A. Tomlinson, the founder of Chrissy and also Savannah Medical Clinic, is a surgeon, and he is, of course, the owner. We also have our family physician, Dr. Shamari Blake, that is there, and he heads the weight loss program along with Dr. T and Dr. Grant, as you see here. And Dr. Grant, our gyno, our newbie, our baby, that is now there, and we are so excited about her being there, because we know a lot of time patients would love to see a physician, especially the female patients. They feel more comfortable, and now we finally have a female amongst the mids. And so those are our 3 physicians, and they are complemented by 2 nurses and an associate nurse. So we have pretty much 2.5 nursing there, and also the administrative team that I lead with our patient financial officer. Many persons, I don't want to call any name, but many persons know her as the relation person in the community, Tanya. And she's dear to us. We really love having her there. And so she leads, she sees the patient needs, and she's always there to tell me what they need, the issues they're having. So we have her on our team. We also have an administrative assistant, and we have 2 scheduler. So that's pretty much about 10 persons we have on staff. And also we do have the cleaners. We want to mention them. They're part of that family because we see ourselves as a family. And although they are contracted, they too are there. So that's pretty much our team, about 12 to 13 persons that works there. And as Robert mentioned, he's there, and that's the 13th.
But also the team doesn't stop there, because the new facility also includes
Pharmacy.
the pharmacy that is coming on
Excited.
stream
Oh,
shortly.
yes.
This is going to be incredible.
Oh,
Again,
yes.
focus on affordable healthcare, affordable access to prescription drugs, as well
One-stop
as
stop.
as well as the X-rays and radiology.
Oh, yes. We want to talk about that too, because we were gearing for a one-stop shop where a patient can come and they don't have to be running here and there. They come and they get the service, they maybe get a referral, they can just go right there. Across to our next room to get their X-ray, their ultrasound. So the SI is also with us right now as we speak.
And there's a small operating room, so small.
Oh yes.
It's an incredible facility.
So Dr. T is a surgeon,
So
as you mentioned.
It's actually a mini hospital.
No, we wouldn't go that far. I really couldn't go that far, but we can do many things, minor surgeries there and stuff. So yes.
And I'm sure, I mean, with the heart of the founder,
yes,
it's going to be affordable to
definitely. That's what his aim is. That's always what Dr. T's aim is that nobody is turned away from medical care. We will do our best to ensure that you're being seen.
Wow, that's
and we are not there to stress you. You're already sick, and that is a stress on its own. So we are there to de-stress you.
That's amazing.
There you go.
It's always amazing that there are options as you make decisions, and this is a good option. Coming up on the 1st of August, it's going to be, I mean, all you have said already, it seems like you have a customer appreciation day every day.
Yes, we do appreciate them every day.
The 1st of August, Jamaicans would call it Emancipation Day. This is Customer Appreciation Day. Tell us what's going to happen.
All right, I'll start and I'll let my team continue. We felt it necessary to really show our gratitude, express our gratitude to our patients in the community, to let them know that without them, there is no Savannah Medical Clinic. And as I've always said, we're a family, and we find our patients as part of that family, and we consider ourselves as a body. And I would say that body, the patients, is the heart of Savannah Medical Clinic. And without them, without the heart beating, we are in trouble. And so we want to express our thank you, our our need for them to be satisfied and to express their needs to us. As I said, I'm a community relations person, and I'm there to ensure that their healthcare needs are met totally. And so we are there. We want them come out August 1st to come and enjoy, of course, some gifts, some games, as what Robert said, but also to see the facility. Oh, we have broadened our scope. Oh, now they can be much more comfortable, and so many other service that we are planning to put on stream. And also want to hear what else they want us to put on stream, because we're there to please them. And that's what the plan is for. So we want them to come, everyone. You come in, do and carry your children.
Yes.
Come and enjoy. We are going to do games. We are going to, gifts. We are going to give you a tour. You stop and get a cup of tea, whatever it may be, something to eat, light, but come down and enjoy yourself with us.
And Nadine also went above and beyond to go out and pick out some nice, interesting prizes that persons will be able to get a nice gift bag with some interesting things to memorabilialize. No, that's the wrong word. Just kind of. to help you to remember the day. And this also provides an added benefit. Sometimes when people are trying to find a doctor, you have to go and pay and figure out who the doctor is and then see if you have a good relationship. This is a wonderful day and a wonderful opportunity to come and talk to the doctors, experience them, experience the facility in a low stress environment so that you can make the decision. You know what? I really love coming to Savannah Medical Clinic. The next time I get sick, these are the people I'm going to call.
Okay.
Yeah.
Yes.
I know sometime in the program we're going to have a couple of giveaways this month.
Yes, we'll let Dr. Grant just tell you what are some of the giveaways we have right here, and she'll just read them out to you. Yes,
here.
right.
Yes,
We
that
have right
So
now.
let
and
me just give her numbers. I get her numbers for those who are listening, so that you could have it on cue when we decide to give it away. 945-9029. That's 945-9029. Don't call me yet. 945-9029. That's the number that you will call when you're ready for your gift. When you're ready to give you the gift. Tell us, Doctor.
So we mentioned some unique things we've brought to the clinic or the clinic has. And one of them, of course, we say is our weight loss program or special EM chair, but also I'm an obstetrician and gynecologist, and I also do my own ultrasounds. So we would, based on person who can answer the questions, we'd want to give a free consultation. Right, so you can get a free consultation. You've always wanted to lose the weight, you can have a free consultation. You've always wanted to see the gynecologist, you couldn't afford it. For that appreciation day, you can get a free consultation. And depending on management, we can give a discounted fee to your ultrasound. Ultrasounds
definitely, they're right there.
Right, so
Doctor can read some of the giveaways.
Yeah, so we have our
give.
free B12 shots. We can waive some co-pays because you have insurance that covers some. You also have 10% discount on your doctor's visit and up to 20% discount. And of course, you have a completely free consultation. So depending on how you answer the question, you're going to ask some special questions.
Yeah, we'll just do a few, and doing throughout the day, we might leave 2 more with you that you can continue on your own question throughout the day. But I personally, I did ask Dr. T to send me something I haven't seen. Poor Dr. T is so busy. Let me not say poor. Healthy Dr. T is so busy and maybe didn't get to come back to me on this. However, I have one that I want to share. Dr. T is coming from a family that pride medicine. And his grandparents both were never trained in medicine. Yet his grandmother delivered over 700 children.
Wow.
Yes. So she was a midwife in Cayman. She was from the Bronx, over 700 or more.
She's from the
She's
Bronx?
yes.
And she did that in the Bronx?
Yeah, and here to Cayman, she delivered over.
That sound like
yes.
She delivered the full population.
So you can imagine, and her husband could set any broken bone. So he was like an orthopedic.
Really?
Yes. So both husband and wife never professionally trained.
Wow.
And so he's stemming from that. And our Dr. T medical mindset came in, and I can imagine that was in his DNA.
Yeah.
But it came in from seeing his own grandfather suffered from he could not urinate at a point, and it was very painful. And he said, just seeing that, you'd never want a person suffer like that. Wow. And never want a care not to be to your dignity. And he made a vow that you'd never want to see suffering like that, and so he would want to be a physician that in his community this will never happen. And so that's what one of the things why he became a doctor. So my question for my famous great-grandmother, if anybody can tell me what is her name, what is that famous grandmother's name?
Can I?
No.
That makes sense. No, it all makes sense.
I know a Braca might be just under to call in, but Cayman Islands also should know.
It all
But
makes sense.
yes. And you can't just give the last name. I want her full name. And so if you could know her name, which would be very good, definitely one of these prizes would be yours. And the other question I'd love for somebody is, how long is Dr. Tomlinson practicing medicine? That might be easy for someone. Should be easy, but let's see. How long? How many years?
So we can throw out the hard one. So the person who can remember that name, they can get the full free consultation.
Right.
And then if we have how long, because I think you said it this morning and you corrected it. So if someone calls in and says, hey, how long has Savannah Medical Clinic been open?
Yes.
We know you've been listening. We can give you a 10% discount, right?
Of course.
Yes.
We
Interesting.
mention it.
And, I as you said, Nadine, I can continue giving away those prizes on the air because we're actually 3 minutes into and there are some other information that
Yes.
is very, very important. Savannah Medical Clinic, a lot of persons like me would have gone to countryside and
Country Corner. Let's.
I would have gone to
Oh, yes.
and say, they're not here anymore.
Yes.
And just drive back because I would think that Country Corner is just restaurants and whatever, right? That's what it is, right?
Yes.
So are you where you used to see that GMC?
No.
We're on that side, actually, over the other side. They're around the corner
Exactly.
at
Yes.
GMC.
So
yes.
when you come into countryside,
as you
GMC
go
will be
in.
on your right. That's where that is with the eyeglass place and where Chicken
Right,
is. We're on
exactly.
the left.
No.
You know, Cafe de Sol.
Cafe
Yeah,
del
yeah.
Sol.
We're on that side where Cafe de Sol is now. Fresca restaurant, we're right next door to it,
Okay.
actually.
Okay. All right. So, countryside.
Yes. You go.
There's one way to go into Country Corner because one is an exit and one is an entrance.
That's right.
Right,
Yes.
the
So there's-
So
entrance.
you go to the entrance
There you go.
And then go left.
and then go left.
Yes.
Okay.
There you go.
Yes.
So it's like going.
Credit
So you're
Union is right
so you
on that
drive
section.
You drive into Country Corner.
There's a left now.
Yes, that's it. So they've expanded to include now Credit Union is over there.
Fresca is there. We're
and
there.
Savannah Medical Clinic is there.
Yes.
There's something that you didn't say.
Yes.
That I want to say this morning. For those, and this would fit in well, for those who have to do their work permit medicals and stuff.
Yes,
which includes X-rays.
Yes.
This will be
One-stop shop.
this will
Definitely.
this is
Yes.
one stop.
One stop.
Yes.
Because when you do it in town, you have to do one
Go someplace
over
else to go and do
and
the.
then you do one over here.
No.
Um,
Everything is done
Everything.
there and you get it back the same
and
day.
you get it by the same day.
Yes.
Yes.
Perfect.
Mhm.
Again, we're caring for everybody, and I'm sure if you get to at one place, the price has to be better.
Yes, the price is quite reasonable and
has to be
it hasn't
better
changed.
than if you
Hasn't
go to
changed
different
over the
places.
years. Very reasonable.
Yeah.
Same
And
price.
also, I mean, you can't underestimate the value of not having to drive all up and down over the place to go to all of these different places
and wait lines, because when you move from this
Yes.
place and then you're in a line here,
Yes.
it's not like you just go to the other place and get direct service at the same time.
There you
and
go.
Continuation service. You have to go join another line.
And then when you think about having all your doctors in one place, because you can't underestimate that as well, having all your medical records in one place, when your doctors are able to communicate and talk about what is going on with you. Sometimes as patients we'll go over here because we have a pain in our back, and then next week we go down there because we have a pain in our foot. But when you put those two things together, there might be an underlying cause. That's one of the awesome things that having all of these doctors together with the imaging and all of those things together in one place gets a chance to work through, and that's part of the technological advancements that Nadine is rolling out in terms of a new software that will allow persons to be able to manage their own records. So even if you need to go overseas and you need to have a doctor review all your records, everything will be in one place. So
And you can schedule your own appointments. We have payment portal. So we're trying to make everything efficient and easy for you.
including having telemedicine. So for
Oh,
come
yes.
by and enjoy the place. Or
If you don't feel like coming in because you're feeling so sick, maybe with the flu, we do have telemedicine. We also have physicians that go and do home visit.
There we go.
So name
guys,
it,
guess what?
we have it.
You'll have to come back. You'll have to come back. It's 8:30, but you'll have to come back. There's something else that just came to my mind. Well, I've learned a lot because I've had so many different physicians here.
Mhm.
And I see the benefit of having this one-stop shop because you mitigate against polypharmacy. Instead of going here, there and getting this medical advice and buying this, plus what you heard, what kind of bullshit and that over-the-counter drug. There's going to be a pharmacy here.
there you go.
So you get
Yes.
directly from...
Yes.
Excellent, excellent. Give me some parting words, please.
All right. I personally want to say Savannah Medical is a stress-free environment. We
Yeah.
try to create that. We want the health, the mental, the physical, everything for a patient to run right. I want to say we want every single patient to come out. All our past patients that haven't been there a while, come out and see the new facility. Come out and enjoy the giveaways and the gifts.
Can I come before Friday?
Yes,
Because
yes.
I can't come Friday.
Yes.
You can.
Yes,
because we're open.
yes. We're open from 8:30 to 5:30 every day. Not every day, from Monday to Friday, and we're also open at Saturdays. On
Okay.
Saturdays from 9 to 2.
Okay.
So those 6 days, feel free doing. Come on down. And if you can't make it on Friday,
I can't make it.
come and see me before that.
All right.
Definitely.
And please come and try the chair.
I'll try
Yes, go on.
everything there.
Okay.
Yes.
I'll try.
And we want the community to join with us to make, healthcare, build the healthcare facility, the best healthcare facility they want, what they see, and at affordable cost. That's our aim.
And
Any last words from me?
Well, Savannah does not have a specialist for obstetric and gynecology. So I'm here, so all the persons coming from East End, Town, I'm
Yes.
here at Savannah. So if you didn't know, you know now.
Yes.
Come and get screened for all female issues I can handle. So we offer holistic care. You can't know what you have until you come and have it checked out. It's always best to know.
Mm-hmm.
All right?
Yeah, it's
Knowledge
always
is
best.
power. So come and get screened.
And
Even if
health is wealth.
your health is your wealth. You can never buy it back.
Mhm.
All right?
And if you listen to her voice, she's super calm and super supportive. And sometimes these things can be really stressful, especially some of these challenges that you've mentioned today for the men and for the women. So come in and do your private screening. Come in and do your private assessment, knowing that everything that you discuss, she is going to support you through it. So
Thank you, Robert.
And thank you, Dwayne, for having us.
All right. If you can't go, they also have telemedicine, and their
Of
number
course.
is
749-6066. And we at Country Corner, Unit 1D, next to Fresca Restaurant. And for those who know Cafe de Sol, not advertising, but on that side.
And if
So-
you don't like telemedicine and you want someone to actually come out, you can call that number just the same, and a doctor can come see you.
6066. 749-6066. And for those who are listening overseas and maybe checking out the Cayman Islands, 345
345
749-6066.
Do you have a website?
Yes.
www.savmed.ky.
Again, www.savmed.
Savmed.ky.
So
SAVMED.
those listening overseas, if you're coming in on a plane, if you're coming in on a boat, and people get sick, think about Savannah Medical.
And for you to know, because those who are listening the BRAC and Cayman Islands, because somebody might call in regarding my grandmother, they too come. We have
Yes.
patients from the BRAC that flies in to get treatment at the Savannah Medical Center.
So let me just
Clinic.
tell you something. I mean, we're way over time, but let me just tell you something. For those who are in town, And don't worry about Savannah being traffic.
No traffic.
There's traffic
Smooth coming
from
down.
Savannah.
There you go.
Yes.
There you
There's no
go.
traffic
Yes.
going to Savannah.
We have
So-
patients from West Bay coming to see
So
us.
you might end up getting through earlier
You better
That's
believe
right.
it.
if you go to Savannah in
Yes.
the morning or anytime.
Yes, Dwayne.
Because that's how I ended up getting there the first time, you know. Apart from I really value Dr. T's
Service.
and expertise. I would feel confident going to him personally. But it was easier for me, as much as I was in town, to drive up to Savannah, and I got through like so.
Yeah, we pride ourselves on that.
Yeah.
Our patients should be seen at least by the nurses within 15 minutes of
Yes.
reaching there.
Yes.
And we do that most cases,
Yes,
I
yes,
must say.
So if you're listening to us and you're stuck in traffic right now and you know you are feeling a little bit sick, turn around. The traffic is
drive
going to
right
be a
back
lot
down.
smoother. Head right
Coming
down
down.
to Savannah Medical.
I'm going to try that. What's the name of the chair?
M-Seller chair.
M-Seller chair.
Yes.
Go and try that M-Seller chair. This
Of
has
course.
brought us to the end of Red Start for this morning. Please come again, guys. Please
We
come again.
definitely will.
I'm sure
Looking
there's-
forward, we'll be having and it is World Joy Day. August 1st will be World Joy Day for our Appreciation Day, but also we will be having Men's Day coming up in November and Gyno Day coming up in September. So
And
we're
breast
looking forward to
cancer
come back
awareness.
doing.
So with
Yes.
those settings, we can structure where you can have a time to really sit down and talk to the doctor. So you can have your guests call in and maybe have some conversations with the
Question
doctors.
ask.
Question
Yes.
and answer sessions.
Dear physician,
Excellent. Thank you so much.
All
for
right.
coming.
thank you
guess-
for having
Sorry
us.
for rushing
Thank
you.
you.
out.
That's fine. We're over time, but we are pleased to be here
Come by
and
on
we're
Friday
thankful.
and find out more.
And guys, if you only heard a part of this conversation and you wanted to hear what was said before, you can go to our YouTube channel, CIC Media KY, CIC Media KY, and you'll see this this broadcast for this morning. Thank you guys for coming. Have a good Thursday. And for Jamaicans, enjoy your emancipation
Today is Tuesday.
on Friday, which is the same day.
Okay.
A lot of things are
Thursday,
happening on
okay.
Friday. World Joy Day, Jamaica Emancipation.
Oh yeah.
Alright.